Lateral canthoplasty is a surgery of the outer aspect of the eye. Lateral canthoplasty is performed to open the outer aspect of the eye to essentially enlarge the eye on the outer aspect. So this procedure is performed because aesthetically you like the eye shape to be proportional to the width of the face. And Asian faces tends to be wider than Caucasian faces, and Asian eyes tend to be narrower than Caucasian eyes. Therefore, a lateral canthoplasty is a very effective procedure to elongate the eye in a horizontal fashion. Furthermore, a lateral canthoplasty can also alter the tilt of the eye, where the angle, if it's angled too high, it could be brought down, and if it's too low, it could be brought up. So if it's too high, then it gives one a very sharp, too sharp of an appearance, and if the lateral tilt is too low, then it gives person a very dull appearance. A lateral canthoplasty in the past used to be a simple opening of the outer side of the eye. So essentially the surgery entailed cutting the outer aspect and then leaving it open. However, this procedure relies on wound healing aspect, where by leaving the outer aspect of the wound edges open, it will naturally close up. This is how our body heals. Therefore, lateral canthoplasty has been fraught with a complication of reclosing. So in effect, it wasn't effective. And physiologically, it makes sense that our body would like to heal itself, and just by leaving it open, it's not going to stay open. So a newer lateral canthoplasty technique does not rely upon leaving the outer aspect open, but it essentially reconstructs the outer aspect and doesn't leave any raw surfaces. So it doesn't allow your body to reclose. Therefore, it is effective because there will not be any change after the surgery. And furthermore, as I mentioned about altering the tilt of the eye, in the past, lateral canthoplasty entailed just opening the outer aspect only. But now what we could do is we could alter the tilt of the eye so the outer corner can go up, or it could also go down. So this is a very powerful method to change the appearance of the eye. It's a very powerful method to give somebody a more feminine look by elevating the tilt. Or if it's too high, where the image is too sharp, you could bring it down slightly to give it a more softer, appropriate appearance. Lateral canthoplasty, in conclusion, is a very powerful aspect of Asian eyelid surgery. It gives somebody an overall feel of how they look, because a pretty eye is not just an eye with a double eyelid crease or a double eyelid fold, but it essentially is balanced with the rest of the face, and it's also the tilt of the eye and how the eye is positioned that gives one a very attractive appearance.